The common symptoms of a urinary tract infection are that you pee often, that you feel the constant urge to pass urine. It can sting or burn. The urine may be foul smelling. Sometimes it's cloudy. Some patients complain of lower abdominal pain, that you may have chills and rigors or else fever, running high temperatures. Some people may feel tired. If the urinary tract infection from the bladder goes up to the kidneys, you may feel loin pain, you may be feverish, and you may feel sick. Urinary tract infections are diagnosed by doing a dipstick test, which can be done at the pharmacist or your GP. If this shows traces of white cells and as well nitrites positive, a urine for culture and sensitivity is sent to the lab, and bacteria are cultured. Additional tests include an ultrasound of the kidneys and the bladder, and to make sure that you're emptying completely. In addition, if there is further suspicion, one can order a CT scan to look into more detail to exclude, for example, stones. If you have recurrent infections, your general practitioner may refer you to a urologist to undergo a camera test called a flexible cystoscopy. So the causes of recurrent infections are what we call multifactorial. That means that there is usually a genetic element where we have our defense systems not as good as other people. Our lifestyle can contribute to that, for example, from lack of drinking, stressful jobs, our dietary habits. Maybe we're taking too much sugars, or our diabetes is uncontrolled because of that, and as well environmental factors. The best way how to prevent a urinary tract infection is always to drink. So the commonest thing that I find from patients basically is lack of fluid intake. We think that we are drinking, but in reality we are not. I always tell my patients that use the color of urine as a benchmark of your hydration. If the color of urine is close to water or that faint yellowish, then color, then you are drinking enough. If it's not, then you are not drinking and you need to drink more. It's very important to divide the drinking throughout the day so that you flush continuously the system. That is the most effective way, and most recurrent urinary tract infections are prevented by doing this simple adjustment. Of course, there are other methods that one can address. For example, if you are constipated, you need to start having more fiber, more fluids, and move in order to open your bowels if needed to be laxatives. We always recommend patients to keep an infection diary, all right, in order to see whether there are any triggering factors that lead to these recurrent infections. Because if you find, for example, that sexual intercourse is leading to a urinary tract infection, that can be addressed. If, for example, a stressful day leads to a urinary tract infection as well, that can be addressed. And it's a very simple measure to keep an infection diary. In terms of other things that one can do, these can include wearing cotton underwear, so you avoid tight nylon underwear, washing the underwear with soap only and not fabric softener, because that damages the weaving of the material and therefore the breathability. In terms of diet, one can, for example, implement natural yogurt with live bacteria, because most of the infections are from bowel organisms. These are, in essence, the main things that one can do. So the treatment options, in the past, antibiotics were used repeatedly and, I dare to say, abused. We have to move away from using antibiotics. Simple lifestyle changes, as we've discussed before. So you drink plenty of fluids, all right? I cannot emphasize enough that. You have to perform good hygiene practices. So, for example, in females, after emptying the bladder, you should wipe from front to back. And of course, before sexual activity, empty the bladder before and after. In menopausal females, which are at an increased risk of urinary tract infections, they need to, cause of vaginal dryness, they need to, for example, avoid hygiene products that lead to vaginal dryness, all right, such as vaginal douching or bubble baths. In addition, one needs to ensure regular opening of the bowels. In terms of things that can be done, one can purchase either online or from a health shop the mannose. This is a simple sugar, and it has been found that it can, in some patients, to be effective as much as an antibiotic. It's a bit of a hit and miss, but in those patients that work, it's fantastic, as you avoid all the antibiotic complication, you get all the protective aspect. Your GP can prescribe alternatives from antibiotics like Hiprex, which is basically a sachet that when taken, it sterilizes the urine. In menopausal females and those that don't have any contraindication for estrogen treatment, one can apply estrogen in the vaginal lining, so to regenerate that lining. If the recurrent infections are still annoying, then one can consider bladder installations with a special acid that regenerates the inner lining, that is the defense walls of the bladder. They are currently looking into using a vaccine. The vaccine is not a new idea, it has been there since the 1980s, but some people are enrolled in a program where they actually take a vaccine, which is basically a sublingual spray, meaning spraying underneath the tongue, and that helps to prevent certain infections. If the infections are repeated, your urologist need to investigate your urinary tract in order to exclude any anatomical abnormalities which need to be addressed.